Are you finding it difficult to finish during intimacy, but not having that problem when you're by yourself? Well, you're definitely not alone. I'm Dr. Rena, a urologist and pelvic specialist, and today I'm going to walk you through how common this situation really is and why it might be happening. First, let me be very clear. This video is not about shaming anyone for masturbating. In fact, I believe it can be a healthy form of self-care and a positive way to connect with your body. It can also be very enjoyable for many people. Interestingly, this topic has been explored in scientific research. The first study I'll mention focuses on men, and later I'll also discuss how this issue can affect women. In this study, over 4,000 men from Hungary and the United States were recruited through social media and online forums. It's important to note that participants likely had some level of interest in sexual health or a personal reason for taking part in the survey. The survey included 55 questions. The first section covered basic background details, where participants lived, whether they were in urban or rural areas, along with some medical and sexual history. It also looked at lifestyle habits and asked how often individuals engaged in masturbation versus partnered sex, as well as their general level of sexual interest. The second section focused more closely on erectile and ejaculatory function. It examined 3 specific conditions: erectile dysfunction, which is difficulty maintaining an erection firm enough for intercourse; premature ejaculation, which happens sooner than desired; and delayed ejaculation, where it takes longer than expected. These were evaluated using well-established questionnaires that have been tested across large groups of people and are considered reliable tools for identifying these concerns. What's particularly interesting is that men who experienced moderate to severe erectile dysfunction, or who likely had premature ejaculation, reported far fewer issues during masturbation compared to partnered sex. For those dealing with delayed ejaculation, the difficulty was almost entirely absent when they were alone. So why does this happen? There are a few possible explanations. First, partnered intimacy can come with added pressures, things like performance expectations, concerns about what your partner might be thinking, or levels of attraction. These factors usually aren't present during masturbation. Second, masturbation may actually help reduce these challenges because it allows for different types of stimulation. This can make it easier to maintain a longer-lasting erection and stay in control. Lastly, men may view their sexual concerns differently when they're alone compared to when they're with a partner. For instance, they might not feel bothered if they finish quickly or take longer than expected, simply because there are no expectations involved. As a result, these issues may feel less stressful or less noticeable. This becomes especially important if you're dealing with this at home. If you feel satisfied during masturbation, but struggle during partnered intimacy, it's helpful to have an open and honest conversation with your partner about what's going on. You can also explore ways to bring some of the techniques you use during masturbation into your time together. Your partner shouldn't feel uncomfortable about this. It's really about improving the experience for both of you. Having these conversations outside the bedroom, in a relaxed setting, can make it much easier. And if needed, don't hesitate to seek support from a sex therapist or couples therapist who can guide you through these discussions. Now, let's talk about women. The same research group studied 2,000 women using a similar survey focused on sexual habits, especially how long it took them to reach orgasm during partnered intimacy versus masturbation. What they found was that it generally took longer to reach orgasm with a partner than when alone. On average, partnered intimacy took about 14 minutes, while masturbation took closer to 8 minutes. When looking at how many women did not reach orgasm, about 15% reported this during partnered intimacy, while that number dropped to around 3% during masturbation. That's quite a noticeable difference. One reason for this may be that the purpose of masturbation and partnered intimacy is often different. Masturbation is usually focused on personal pleasure and reaching orgasm, while partnered intimacy involves connection, trust, and both giving and receiving pleasure. Another study found that women who use techniques from masturbation, such as clitoral stimulation, which is very common, and included them during partnered intimacy, experienced stronger orgasms and greater overall satisfaction in their sex lives. So, if your partner masturbates, or if you do yourself, it's helpful to share what works and bring those techniques into your time together. This can improve the experience for both people. The key takeaway is this. If everything feels fine during masturbation, but not during intimacy, it's important to talk about it. Try to understand what's different and what might not be translating into partnered situations, and then work on bridging that gap. It could also be that during masturbation, you're using a higher level of stimulation, whether physical or visual, that makes partnered intimacy feel less engaging. In that case, adjusting those habits or adding variety can help keep things enjoyable for your mind and body. As always, if you found this helpful, be sure to subscribe and share this channel with others. And as always, take good care of yourself, because you truly deserve it.